Cardiovascular disease is highly prevalent in people with diabetes. In fact, it's the usual cause of death in people with diabetes. They tend to have very high rates of myocardial infarction. That's been appreciated for a while. In fact, lots of data supporting that diabetes is essentially conferring the same risk as someone without diabetes who's had a prior MI. That was shown in some older data, which perhaps was called into question, but even more recent data have confirmed that association. So that seems to be true. But what's equally important, though, quite under-recognized, is that people with diabetes also have a high rate of ischemic stroke. So it's not just MI risk, it's ischemic stroke risk. Obviously, this is known, have a risk for amputation, which, while it may not be so high on an absolute level in those that have peripheral artery disease and diabetes, can be quite substantial, especially if they smoke, but even if they don't. And the final risk that hasn't been as widely advertised is the risk of heart failure, which is quite substantial and probably approximates the risk of MI. So a number of cardiovascular outcome trials have highlighted the fact that all these risks are present in people with diabetes, and that's beyond the other risks that are well known of microvascular complications, things like kidney failure, diabetes causing foot problems, which of course is tied into the amputation, but also things like neuropathy as well that can be symptomatically quite problematic, and also retinopathy and blindness. So there are obviously many bad things diabetes can do, but in terms of things that can lead to death, cardiovascular diseases are right at the top of that list. And it's sort of a continuum, of course. There's metabolic syndrome and diabetes, and eventually, if the diabetes isn't well controlled and treated, or sometimes even if it is, development of overt cardiovascular disease. So all these different conditions are quite interrelated, and highlights the importance of identifying people with metabolic syndrome and diabetes early on and getting them on treatment, diet and exercise and weight loss being the first line of treatment, of course, but then oftentimes medical therapy focusing on glycemic control, on lipid control, and blood pressure control. In terms of screening for cardiovascular risk, I think especially for any of the primary care physicians in the audience, it's really important to do every visit. For sure, you want to screen for things like cholesterol and blood pressure and glucose, the way the various societal guidelines recommend in a formal sense, but in an informal sense, in terms of assaying patients' lifestyle habits and what they're doing with respect to diet and weight maintenance or weight loss if appropriate, in terms of daily exercise or daily physical activity. Those are things that I would say every patient encounter should be emphasized, because that can have a lot of impact on patients over the course of a lifetime and can do a lot to prevent the development of things like metabolic syndrome and diabetes or cardiovascular disease or the combination.